Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. For this month's episode, we're going to talk about a topic that's likely on the minds of parents, young adults, and children, and that's going back to school. Most children have already started back to school for the year, and we want to make sure that parents have the information they need to make sure their children with diabetes are prepared for how to manage their diabetes while away from their home. This can be nerve-wracking for many. There are more considerations than ever to think about with the advances in medicines and technologies, so we've brought in a couple of experts to share their tips with us today. I'm Dr. Neil Skulnick, Professor of Family and Community Medicine in the Sidney Kimmel Medical College of Thomas Jefferson University, and joining me as always is my co-host.
I'm Dr. Sarah Wettergreen, an assistant professor at the University of Colorado Skaggs School of Pharmacy and an ambulatory care clinical pharmacist.
To help us learn more about this important topic, we have two fantastic guests with us today, and I'll start by introducing Crystal Woodward. And Crystal is a managing director for legal advocacy at the ADA and for the American Diabetes Association's Safe at School initiative. She is the parent of someone living with diabetes and has personal experience with this topic. Welcome, Crystal.
Thank you, Neil, and thank you, Sarah. We're really grateful for this opportunity. As you introduced me, Neil, I'm the Managing Director of Legal Advocacy at the American Diabetes Association, and this initiative includes our Safe at School campaign. I've led this campaign for over 2 decades, and I also have a daughter who was diagnosed with type 1 diabetes at the tender age of 17 months. She's now 33 years old, so I've had the personal experience of navigating the school situation from preschool through college. So we're really happy to be here.
And I'm so happy you are, Crystal. And one of the things I'll be interested to hear from you later is how things have changed over those 33 years, because I'm betting that the work of people like yourself and Carrie have paved the way to make it not easy, but at least more easy for people now sending their young children off to school. Also joining us today is Carrie Lee, who is a diabetes resource nurse at Boulder Valley School District in Colorado and is a member of the Colorado Diabetes Resource Nurse Network. Welcome, Carrie.
Hi, thank you, Neil. Thank you, Sarah. I am so honored to be here today. I'm Carrie Lee. I am a school nurse, a diabetes resource nurse for Boulder Valley School District. I am also the health services coordinator. I've been a school nurse for over 10 years now with 20 years of pediatric nursing experience. And so my passion has now moved into the care of our kids with diabetes and just being that advocacy for our parents and our students and making sure they have a successful school year. We know that this time of year is so exciting to go back to school. Kids are ready. They're ready for new experiences. Parents are ready. And then it gets a little stressful and the anxiety can come on board. And that's when we step in and we just become that partnership to make sure that it's a successful school year.
Carrie, you mentioned two things that are so important, both the anxiety and the partnership. And as we talk, I'll be interested in hearing your thoughts about how to deal with the anxiety and how to facilitate partnerships, because so important. Sarah, your thoughts?
Yeah, I'm very excited for this topic. I just think there are so many important considerations as we think about all these differences and changes and how the process has evolved and really how parents can take a role in advocating for their child and for themselves to be part of the process. So I'm excited to hear from both of our guests today to talk more about that.
Great. Crystal, can you start by sharing with us an overview of the topic, why this is important, and a little more detail about how you became involved?
Certainly, I'd be happy to do that, Neil. Safe at School is the American Diabetes Association's advocacy initiative that advocates on behalf of children with diabetes to make sure they receive appropriate care at school and are treated fairly by their schools. Safe at School really marries the legal protections of federal and state laws with ADA standards of care to make sure that optimized care is being provided to these children. And this is important because our children spend so many hours at school every day. And unfortunately, we can't just put diabetes aside when these kids board the school bus in the morning. Diabetes is 24/7. So Safe at School provides those resources for parents so that they can be educated about the legal protections for their children, and also resources for schools, and in particular school nurses, so that they have those tools to train non-clinical staff in how to care for students with diabetes. This topic is really important to me personally because about 24, 25 years ago, when my daughter was in 3rd grade, we were told that diabetes care, in particular glucagon administration, would only occur on those times when the school nurse was actually on campus. And unfortunately, at that time, the school nurse was on campus only on Wednesday morning. So if my daughter had a severe low blood sugar episode on Wednesday morning, we were covered. But heaven forbid that she have it another time, what are we going to do? So it was at that time that I reached out to the American Diabetes Association and identified other parents in the state, which was Virginia at that time. And we worked closely as volunteers with the association to pass the first Safe at School bill in the country in 1999. And that law, it's still good law today. And what that law does is it requires Virginia public schools to provide at least 2 non-clinical school staff to be trained in all aspects of diabetes care, including glucagon and insulin. And since that time, I've worked with the association. I've come on board on staff and worked closely with their advocacy team to pass laws, change regulations, change policy in 35 states to enable non-clinical school staff to provide that diabetes care when the school nurse isn't available or is not even on campus.
Crystal, that's an amazing story. Just the idea of going all that time for your daughter without any potential coverage. And while things have changed a lot, and hopefully things are much better in most places, I want to focus on, for a moment at least, for when challenges arise, because there's no doubt that they still do. And can you speak a little bit to what public schools' legal responsibility is to our children who have diabetes, and any suggestions you might have? And I'll ask Crystal, you to address this, and then Carrie afterwards. For when there's a problem, what would you advise parents to do?
Well, students with diabetes, because diabetes is a disability, have legal protections under several federal laws, in particular, the Americans with Disabilities Act in Section 504. So schools cannot discriminate against children with disabilities. And for diabetes, what this means is that schools must provide care. So these laws require they place legal protections upon schools to provide certain care and also to make sure these students are treated fairly. So what the association recommends for all students with diabetes is the development of what's called a Section 504 plan. So a parent who was part of that 504 team would sit down with the school team, usually consisting of the 504 coordinator, the school nurse, who of course plays a key role in the provision of care, to children with diabetes, teachers, guidance counselors, other stakeholders, and those who are knowledgeable about the children. And the first thing to do is to sit down and develop what's called a Section 504 plan, which is a written document that sets out basically the responsibilities of the school, the responsibilities of the student, and the responsibilities of the parents and family. When challenges do arise, the ADA has a mantra: educate, negotiate, litigate, legislate. And that's what we do. And education is such a critical component to resolving school diabetes care challenges. And ADA has a wealth of information, tools, resources on its website to help parents do that, and to help parents collaborate with school nurses, and to collaborate with schools, and also with the child's pediatric diabetes provider.
That's such important information. And Carrie, you mentioned partnerships. When there's an issue where a child's needs are not being addressed, can you speak a little bit to how you would advise parents to best create that collaboration?
Absolutely. We know as school nurses, collaboration and partnership is the only way we function to take care of kids in school. And so my advice is always identify your school nurse and really start that relationship and start that conversation from the very beginning, whether it's before school starts or as we come into school or when that first diagnosis comes in. That school nurse is your partner, your advocate, your champion for within the school setting. They're the ones that can work through all the different situations and challenges and just really the confusion of what can bring about in a school setting. Trying to identify the staff we need to train and delegate to be appropriate for that child, thinking through all the different situations that come in a school day, because we know the kids are so active when they're at school and there's so much they're involved in. That school nurse can be that voice for the parent as they're working through different challenges.
That's so helpful. I'm reminded of, I think it was Teddy Roosevelt who said, "Speak softly and carry a big stick." And when I listen to both of you, the reason why I think that, Carrie, your suggestion to begin that collaboration early is so important. Yet at the same time, Crystal, to recognize that you have that big stick, that there is a legal requirement for schools, and schools know that as well, to act in a way that is correct to our children with diabetes.
Yeah, I agree. And hearing all of this, there are these legal protections, but I'm imagining if you're in the shoes of a parent, you don't necessarily want to have to go to those legal protections and pull out the legislation and show that to a school and be like, we have rights. You want those pieces to already be in place because there are already so many other components you're thinking about as a parent and getting your child ready for safe school experiences. So even thinking of the terms like a 504 plan, it sounds quite technical, but can you either of you tell us a little bit more of like what does that actually look like, and how do those conversations go about with each of those individuals in the room? Maybe Carrie sharing first.
Absolutely. As school nurses, we know and understand the different laws that are a part of the school, students coming to school and being protected and all disabilities recognized. So your school nurse absolutely will jump in and help guide. Like you said, parents hear these terminology, and it's a lot of terminology when you come into a school setting. Diabetes itself brings a lot of terminology, but then you have 504 or special services or whatever else they need. And that's where that school nurse can kind of be that translator, that component that helps you work through those different factors. So when we work with our parents and our students with diabetes, the first thing is our goal is getting those kids at school, getting staff ready to take care of them, and really starting to engage them in the academic setting. We do that a lot of times through an individualized health plan so that we can identify all the care that's needed, all the supplies, the components, everything right away so we can get them right back into school without any hesitation or holdback. And then we can work through all the different components such as 504, accommodations, thinking through different situations as we're getting that student engaged and involved.
It seems to me a key thing because the truth is, for in some school districts, this works very easily, in others it doesn't, and some kids' needs are more complex than others and require more resources. It seems like, Carrie, correct me if I'm wrong, that one of the keys is early on partnering with the school nurse and then making sure early on that there is a clear plan documented, that 504 plan in place, particularly if your kid has complex needs. Because one of the themes that Sarah and I have talked about many times on this podcast is the reason we do this is to empower our people with diabetes, and knowledge is power, and so that am I correct in that understanding? It's early on, making sure things are in place, and then there's more of a natural progression to having a clear written plan.
Absolutely. That conversation typically starts with our families even before we're thinking about school. So planning starts as we are ending a school year and looking at the next school year as we're getting into summer and we're planning our students coming back. Our nurses really start that process of meeting with parents, that communication, the getting the physician orders, to pulling our health plans together, to thinking through their plan of their day. But even probably 3 weeks before school is even coming into. So it's a process that we want everything in place a week before they're coming back. We want them ready to go. We want the first day to be like any other typical school day, any other typical first day of school. We don't want those worries of coming up with a plan or thinking through supplies or thinking through who's going to provide care. We want everything to be set and ready to go so that student has a great start.
Is it too late now, a month into school, say, if we haven't addressed that already, to say, oh boy, things are more challenging than I thought? Is it too late to address it now?
Oh, absolutely not. It's a continual process that as nurses, we watch their care every day, every week, and reassess and reevaluate the needs. Same with parents reaching out and saying, I'm not too sure that this is going the way I want it to. Let's meet again and reassess this and kind of plan a little bit better. There's never a time that's too late to start that planning.
So, Crystal, I imagine that what Sarah said is absolutely right, that when things don't go the way that Carrie described as planned, it's very awkward for a parent to say, hey, here's what my child needs. Do you have any recommendations how to approach that?
The question I get lots of times from parents is, if everything's going well at school, why does my child need a Section 504 plan? Many parents in some schools view of Section 504 plan as being combative and confrontational. So I think the key is, in addition to the school nurses being ready and for the return of students back to school, as Carrie has described, the other part of this is educating the parents, especially what I call the newly diagnosed parents, because those parents are so overwhelmed and they don't know where to turn, they don't know what to do. And really, the last thing they want to have to worry about is the quality of care or the appropriateness of care that's being provided at school. So I know it's scary, but I think the more education, the better. And really, those laws are our friends, and they're there so that our children's health is sustained. And the word collaborate and working as a team come to mind, because that's really how we're going to work together to be successful in making sure the needs of these kids are met.
Crystal, I think that's such an important point to bring up in thinking of this is a partnership, and as we're working together as a team, we're not trying to, challenge anyone or put one against the other. We all have the same goal in mind in these scenarios. So I think it's so important to have that emphasis and to see these legal protections as friends and part of the support system that are also maybe part of the team and helping. Now, I'd love to hear a little bit more from you about how these processes may have changed over time. In my mind, it seems like these might be even more important things to have in place given there's more advanced technologies, different types of medications available. There might be more use of insulin pump technologies and a little bit more training that goes along with that. So it seems like that partnership would be even more important now.
Oh, absolutely, Sarah. So it's interesting because when I first started my work with the association back in 1999, blood glucose monitoring in the classroom was a big issue. And there was a lot of pushback from a lot of people. And we as parents want to be able to work with the school to transition our children to self-management and independence. So I think the biggest issue back then, this is where this has evolved, was checking blood sugar in the classroom. And there was a lot of fear about that, right? Oh my goodness, blood in the classroom, contamination, and
Needles.
needles. Oh my goodness.
Oh
So
my gosh.
that was a matter of education. And then I think the next big issue was probably glucagon administration by non-clinical school staff. And there was a lot of fear around that because the thought was again, oh my goodness, it's so sharp. What if I hurt the child? What if I, don't mix the solution correctly? Well, my question always was, well, what if you don't try? What if you don't have someone trained other than a school nurse and that school nurse is not on campus that day and a child experiences a severe low? What are we going to do? Call 911 and wait? So I think that was the next big challenge and point of education. And as you pointed out, with technology just changing so quickly, and I want to recognize too that school nurses have so much on their plates, so many competing priorities. And they definitely do understand the mutual benefits of all the new technology, pumps, CGMs, but again, they have time to learn, and that's a lot, and that can be overwhelming. So I would say now the biggest challenge is providing that education to the school nurses so they are confident in helping a child who is using technology. And the parent can really be a tremendous resource for this information. And so are our diabetes educators. They can do so much to help educate the school nurses and give them that confidence they need because new technologies are going to just keep coming and certainly making life easier for patients with diabetes and easier in the long run for their caregivers. But it is all a learning curve.
It strikes me, Crystal, as you say that it's important for our parents to realize they are the expert in their child's care. That often as parents, we assume that our experts know everything that is needed. But boy, particularly when it comes to type 1 diabetes or someone with fragile diabetes, um, parents know their children and should not be shy about stating that because as a primary care physician, and Carrie, I would assume you as a nurse, the new technology can be pretty overwhelming if you're not the world's expert in it. And yet a parent often learns how to use their child's technology, how to help their children in incredible depth. So as a parent, one of the things I'd suggest is don't be shy about sharing your knowledge. Does that make sense, Carrie?
Oh, absolutely. We view our parents as the expert of that child. Even beyond the provider who takes care of the child, those parents are with the kid 24/7, work through all the challenges, of everything that they're involved with, whether it's technology or medicine or activity and how that affects them. Everything. They are the expert, and that's how they're viewed when we're working as this team. They're the expert for the child, and the school nurse is the expert for the health services within the school setting.
I would agree that the parent of the child with diabetes is certainly the expert on their child. It's the parent who knows what the child has been doing during the day, what the child's been eating. Maybe the child has had swim team practice in the morning. It's knowledge that the school nurse might have and would have to inform that school nurse. And it's the child's diabetes provider who's the expert on diabetes. And then certainly it's up to the school nurse and the school nurse's team to implement that diabetes medical management plan or plan of care during the school day. But I also want to say that parents also need to be reasonable. I always say, ask for the universe, but expect the world. So my advice is when parents go in and work with that 504 team, what does their child absolutely need, and what services might not be as necessary. So ask for the universe, expect the world in that negotiation, and it usually is a negotiation.
What great advice. As we get toward the end of our podcast, can you share a bit about where parents can go to learn more and access resources relating to this?
Yes, parents, providers, schools can contact the American Diabetes Association at 1-800-DIABETES or email us at askada@diabetes.org. We have a wealth of information. We also have a legal advocacy manager on staff who will send an individualized email providing help and guidance to those parents who are seeking assistance to work out school diabetes management issues.
Excellent. And Carrie, any additional thoughts you have with regard to where parents can go?
Absolutely. I just want to share that we are really lucky in Colorado that we have diabetes resource nurses within our districts. And so we have this foundation that's Diabetes Resource Nurses of Colorado, and they're the experts of diabetes for the school system. So usually all our districts have a DRN, and then we have regional DRNs that work for our smaller districts or BOCES throughout Colorado. We provide just that expert advice, that resource nurse, that consultation for parents and for our school staff, because diabetes is complex, and it takes a lot to stay on top of it. It takes a lot to stay on top of technology, and that's what our DRNs are for, and it's a great resource. We have a website, coloradokidswithdiabetes.org, that has all of our resources on there. That is a great place just to kind of that merges that diabetes care in the school setting.
We only have a few minutes left. Carrie, can you share any last thoughts you have before we bring the podcast to close?
Absolutely. I just want to say thank you for bringing this. We know that this is a topic that there's a lot of challenges involved for all that are a part of it. And really, it's appreciative. And I know Crystal is the same, that we love that we can talk about this and support our families and our students. This is exciting time of year. School's back. We're really busy. We're active, but there's a lot of anxiety. I mean, you're letting someone else care for that precious child that you've cared for all summer. And just know, in the school setting, your school nurse is your champion, your advocate for that student and for their families, in making sure that year, the academic school year, is a successful one for everybody.
Fantastic. Crystal, any last thoughts that you have for our audience?
I echo everything that Carrie has said. The school nurse certainly is the champion for the child with diabetes. Just remember that our kids are in school for a long time. We want to establish a positive and respectful relationship with that school nurse and school staff, and that teamwork, communication, and collaboration are really the keys to a successful school year.
Thanks so much. Sarah, your thoughts?
I've learned so much today from this conversation. I'm so glad we had our experts here to share this important information. And I really think that this episode brings back some of our key messages around empowerment. So, empowering parents to be in the team and be an advocate, but also coming back to Crystal's thought of ask for the universe and expect the world. It is a long term collaboration, and you want to have that positive rapport. So, I think this has been informative.
I so agree with you, Sarah, Crystal, Carrie. Thank you so much for joining us. Of course, thanks to our audience for joining us. I think we've all learned a lot. And that idea of educating, negotiating, making sure that you have a collaborative relationship whenever possible, but demanding that your child gets the care they need if that isn't initially there. All such important things. Carrie, as you emphasize that school nurse being so important, teamwork, collaboration, education. For the American Diabetes Association, I'm Dr. Neil Skulnick, and thanks for listening.